各位观众，大家好，今天是3月4号，我们准时给大家现场带来 Bc 省新冠疫情的新闻简报。照理应该是周4、周1下午3点，但是呢，昨天收到的邮件说是今天是2点，所以我提前在2点1刻左右已经把我们的这个直播的预告已经发出来，通过港湾 TV 发出来，所以会有一个 reminder。那么现在呢，已经到了2点01分，我相信他们应该会准时出现。说实话，最近的新增数字又有抬头，500多。我印象里边，到了2月中下旬的时候，因为每个数字每天新增的数字都是2周之前的活动的反应，也就是说1月底和2月上旬的时候，说实话大家的控制还比较好，比较自律，那时候的新增减少到200多都有，200多300多，这样我印象里边1个礼拜之后又开始反常，都是400、500。按照 Bonnie Harry 的意思呢，如果现在新增每天都是500多的话呢，还是太多了。那么疫苗呢，已经开始，英文里边叫 roll out， 也就实施了。那么从12月开始到现在，已经在大部分的养老院的老年居民以及必须要打的这些探访者以及员工，所以从长期护理院的爆发数量来看，显著下降。这个也是实事求是讲，老人的死亡数字也是显著下降。我记得最低的时候1天就死亡1例，当然还没有到0。去年的5月份还是6月份的时候，有一阵子是0，所以 Andrew Dix 和 Bonnie Harry 都满怀喜悦脸上抑制不住的兴奋的笑容说我们今天总算很荣幸的报告大家没有死亡，新增死亡这个是很开心的一件事情。到了去年的9月10月，因为随着天气的转冷，人们的活动、交流、社交从室外又转移到室内以后，随着天气的变化，呼吸道疾病增加，所以呢导致了这个疫情的反复。同时呢，长期护理院一下子就是爆发出来最高的时候，长期护理院的爆发数量到达了56个、57个。当然了，这个爆发的定义不一样的，英文里边叫 outbreak。他们的 BC 公卫系统 CDC 对各个 setting 各个场所的定义，爆发的定义是不一样的。长期护理院、医院、急诊性诊疗所，只要发觉1例阳性，就宣布为 outbreak。那么学校以及这个家禽、水果等等工作场所是有3例以上，3例及3例以上的阳性，就是宣布为 outbreak。因为所谓定义为 outbreak 之后，一系列的措施都是按照 outbreak 之后去做的。那么学校和工作场所以及零售店等等这些公众地方，只要是3例以下出现的，它都叫 exposure。exposure 中文叫暴露这个说法很拗口，翻译起来很拗口说这个学校有暴露，反正说的不好。那么 outbreak 也不是很好，爆发。那什么叫爆发我们说战争可以爆发英文里边 outbreak 是 war outbreak。那么只要发现1例，他也说疫情爆发。但是对我们来讲，好像就有点言过其实了。当然，他们可能这个 outbreak 在公卫系统里边的定义不一样。它这个定义就是 我宣布这个地方为 outbreak， 那么之后的一系列的措施、保护措施以及限制措施，都是按照这个 outbreak 的定义之后的一系列的 code 来做，大家都按照这个规范去做就行了。同时呢，exposure 也是 exposure， 如果这个地方这个环境宣布为 exposure， 那么所有的措施啊、预防啊以及处理啊，都是按照这个 exposure 去做了啊。所以这个我也跟大家说明一下。那么前几天呢，昨天还是看到一个新闻，当然这个是题外话了啊，因为中西方对这个病的定义。我不去谈这个政治啊，我们不说政治理念，那么也是比较有区别。在大陆呢，你核酸检测阳性不算，他还不能说你这个是新冠肺炎啊，这个帮你在拗口。因为按照这样的话呢，我们 Bc 省其实也就260几个人住院，那么就是他们是真正的是叫肺炎患者。那么大陆呢，要定义你肺炎患者呢，还要什么呢？新冠肺炎患者呢，一个是几次检测要阳性，第一；第二呢，还要做 CT 肺部 CT 看你肺部是不是发炎了等等等等3个。当然了，还有领导签字，因为一宣布肺炎的话，整个政府就要动起来，所以不是你医生说肺炎就肺炎的，不像这儿阳性了阳性了就一个数字而已。你说 Bonnie Henry 一点压力没有吗？不可能，他也希望天天数字少但是他这个压力会给下面说，你今天少报一点这个我不批，不存在的。所以我撇开了政治这个色彩意识形态。那么再说到死亡，昨天看到一篇文章，万维读者网提到的，就是报道的说，财经网国内的官媒财经网发表了一篇比较偏科学统计的去年1月、2月武汉封城期间的死亡人数这个数字一下子就比平时高了8倍同时呢，这个很多是猝死，他因为又没有检测过，又没有什么，就死在家里，都归纳为猝死。然后呢，那个交通死亡呢又下降，因为都封城了嘛。但是总的死亡人数又上升了比平时上升了8倍所以大家可以偏计算出去年同期武汉的死亡率是多少当然这篇文章后来被404了。那我想说的是什么呢？也就是说，英文里边大家后来都简称了死亡多少，死亡多少。但是严格意义上来讲，新闻报道呢，他说是跟新冠相关的死亡。那怎么解释呢？就是说有一个人他死去了，因为在 Bc 省呢，一定要有验尸官的报告。不管你是什么原因，你在医院也好，家里边养老院也好，或者是临终关怀医院也好或者在普通的医院也好，或者在街上也好，家里边也好，一定要有验尸官 coroner service coroner service 在西方他们来了，我废话不说了他们足足迟到了10分钟。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, March the 4th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, at around 3 o'clock, we'll be providing a written briefing with relevant information, including case numbers for COVID-19 in British Columbia. And next Monday, we'll be back here in the Press Theatre here in Victoria to provide an in-person briefing. Next week, later that week, Dr. Henry will be updating some of the modeling and updating the course of the pandemic in British Columbia next week around the time of the first anniversary of the declaration of the pandemic. So that's what you can look forward to in the next week in terms of briefing. And with that, it's my honor to introduce Dr. Bonnie.
我们的首席医官 Bonnie Henry 给大家做
Thank you
简
and
报
good afternoon.
大家好，下午好。
To start with today,
数字来了。
we have an additional 564 new cases of
564个
COVID-19 reported in the province, including 12 epidemiologically
包
linked
括12个疑
cases,
似
bringing the total number of people in British Columbia with COVID-19 to 82,473. Of those, 168 are in the people in the Vancouver Coastal Health Region, 279 people are in the Fraser Health Region, 35 people are on Vancouver Island Health, 36 people live in the Interior Health Region, and 46 people live in the Northern Health Region. We now have 4,743 active cases across British Columbia, of whom 248 are in hospital, 63 in critical care or ICU. And we have 8,659 under active public health monitoring. And on the positive side, 76,289 people are now
差不多8万人已经痊愈了。
We've had 4 additional deaths in the last day from COVID-19. Bringing our total to 1,376 people in our province who have succumbed to the virus. And our condolences go out to our families and care providers and our communities who have lost loved ones during this most difficult time. We have no new outbreaks to
没有新的
report today.
爆发的新增爆发。
We have 7 outbreaks in long-term care and assisted
7
living,
个长期护理院
now in independent living,
现在只有7个了，这个很好很好。
and 8 outbreaks in acute care settings.
还有8个急诊性诊疗所在爆发状态，很少了。
Long-term care and assisted living involved 269 residents in 131
这200多个269个居民现在还在隔离期间阳性。31个
missing one of my notes around
他的没了伯尼医生也比较粗心
as you know, we are following quite closely the variants of concern that are rising in the province and across Canada. And we've had an increase today of 46 new confirmed COVID-19 cases that are variants
变异病毒46个新的
246 that we know about in the province. Of these, 16 cases are still active, and the remaining
一共16个是在记录在案的那么
218 are the B117, which is associated
219个还是英国病毒
and 28 are the B117,
28个是在南非病毒
which is initially associated with South Africa. The majority of these variants of concern continue to be in Fraser Health in Vancouver
主要是菲沙和沿岸
178 people in the Fraser Health region and 60 in the Vancouver Coastal
78个是在菲沙60几个在沿岸
continue to be just the same small number 6 on
还是6个在岛上这个变异病毒 那么我不关心这个，我主要关心这个疫苗。
As you know, we are most concerned as well about transmissibility and where people are becoming infected with variants of concern.
那么他也是说到了传播的问题，他说这个大家也是关心的。我们现在还是有困难，不知道有些病毒是怎么传来的一般是25%，四分之一的人不知道。现在有4个住院只有4个住院的
As you know as well, since the start of our immunization program, we've had we're almost at 300,000. We're 298,851 doses of vaccine have been administered across BC, and the number of second doses is about 86,746. And as you know, we made the decision as more
29,851个this
week.
其中86,000已经是打了第2针了。那么他也是说到了第1针和第2针的时间延长到4个月，也就是上次有一个读者网友给我提出了意见了，是49天不是49周，16周。
That we made particularly around the extending of this interval.
那么他也是说到了为什么我们要延长第1针和第2针之间的间隔，因为科学的依据以及来自英国其他国家的大规模的数据来支持，同时我们 BC 省的居民打了之后身体里边的抗体的水平，所以这样的话呢，能够让 更多的人先打第一针。他说，每天每个礼拜，我们都对病毒以及疫苗学了很多，以及安全，所以我们就做出这个决定啊，不是轻易做的啊，我们是花了一点时间，我们是花了一点时间来研究，然后呢，再看到了这个礼拜之后周末，我们才做出这个决定。同时，我们也是从国际免疫组织疫苗组织机构协作合作这个了解到的这个做出了决定。这样的话呢，很多的人就会第一针先打起来，能够在社区更多的社区建立广泛的防线。这样的话能保护我们的护理院，保护我们的社交社区。所以很多人呢，可能的第二针会拖几个月才能打。我也对很多这个如果引起了有一些人的不安表示抱歉，请大家谅解，也请大家谅解。我们所做的这个决定都是具有科学精神的，不是我们是为了让每一个人的利益扩大化。
To a community member, to another member of our family, our community here in BC.
所以这个也是他始终强调了，请大家一定要相信科学。
Also want to address the fact
同时呢，他也是就强调这个国际的免疫组织协会都给我们很多的支持，给我们的这个方案做了背书。同时呢，我也个人表达这个对这些专家提供建议，表示感谢。
Immunization have also been both members and chairs of NACI, and we tremendously respect the work that they do, and we're just very grateful that
所以我们也对他们所做的工作成果，我们也表示尊重。
These critical issues for us in BC and in Canada. As you will also know, the first deliveries of the AstraZeneca Serum Institute of India COVID-19 vaccines.
那么他也说到了阿斯利康已经要到了，我们印度产的下礼拜都要到了。我再说一下，上次礼拜一早上说的疫苗计划里边，大家4月份开始注册预约的时候，可以说我要哪一种疫苗，所以大家可以根据自己的了解判断去选择我要辉瑞还是莫德纳还是阿斯利康。
That we now have these vaccines earlier in this program, but I also recognize that the category we're talking about, first responders, essential workers,
那么他也是说到了该打的那些人，哪些人就是基辅所工作的人那些人群我们也要定义清楚那么包括那些救火队员包括的那些急救人员等等我说的急救人员是指出交通事故以及这个救护车的这些人员，他们都是这个急救人员都是给他们优先次序。所以他说我们是先是制定了这些所有的流程，然后呢我们才严格的按照这些流程来做。
Who vaccines could be available to, who would be the priority population.
所以他说在制定优先次序的时候我们是按照这个人类的群体的这个种类来定义的。
Early on, we didn't know if vaccines would be effective in older people, as many other vaccines are less effective. But we now know that they do work, and they work very well.
那么从一开始呢，我们就知道这个疫苗比其他的疫苗更有效比如说流感疫苗等等等，都是50%、60%。但我们一开始就知道这个新冠疫苗的有效率达到80%、90%。那么这次打了之后呢，我们更加坚定相信这个疫苗的有效性是很长的，而且呢会很长时间。第一针他上次说了，在体内这个高水平的抗体会有4个月。
for many years.
那么今天的伯尼医生花了很长的笔墨，都在谈这个疫苗的作用，以及第一针和第二针为什么要延长，他不断的在做解释，希望大家能够理解。
And the analysis that's done by our standing committee, the BC Immunization Committee, which is our provincial level equivalent. And this committee uses public health, both the immunology, vaccinology, vaccine science, and public health principles, as well as an ethical framework. And I would refer people to the BC CDC website, where we have our ethical framework for decision making around vaccines as well posted. So based on this information, we will the
所以他说，综上所述，那些信息我们刚才所分享的我们所以制定了哪些人先后获得疫苗，给他们施打只有等疫苗更多的时候我们怎么打等等，哪些呢暂停一下哪些人先打，或者呢我们会给那些建议
over the next week to 2 weeks.
那么接下来的1个礼拜、2个礼拜以后呢，我们会有一个详细的信息，因为已经开始施打了我又有些详细的数据我们都会告诉大家。那么阿斯利康呢是在18号，那么印度的这个一批货呢下个礼拜就会到，那么只要到的话呢，我们就会马上就开始打。那么同时呢，我们也要像扑火一样，有些社区有些比如说养老院等等，它那个感染数在快速增长，那么我们也要给他们先施行等等所以所有的这些因素对我们来讲都比较困难，都具有挑战性我们要整个全盘考虑如何避免这个工作场所以及社区里边的传染。那么今天也给大家再做一个更新在过去的几个月里边都跟大家不断的说过那么就是说到了这个我们的测试的策略，也就是给大家做测试的策略这个测试呢也是我们应对新冠病毒的一个疫情的一个重要举措。那么我们同时呢，我们是已经又不断的在改善我们的测试策略。那么从11月初到现在，我们就不断的在变化，不断的在改善我们的测试的政策。我们现在也引进了这些新快速的测试它叫 PCR， 我也不知道什么叫 PCR中文怎么说不知道。他说这个 PCR 是全球就是全球通用的标准，是最精确而且最敏感的我们现在已经有这些仪器设备了那么都可以现在一些分布在一些诊所和实验室。
We had a few here in BC already that we repurposed to be able to put in smaller communities. And the whole purpose of that was try to reduce the turnaround time from when somebody got a test to when they got the results. And we report on turnaround times. And for PCR testing, the turnaround time now is less than 24 hours. And in most places. But in some communities, the travel time to get even to one of these point-of-care
结果要3天2天以后才知道结果，这样的话这个2、3天他到底要隔离还不隔离这个要都是存在的风险。所以呢他说这个目的就是为了减低这个 turnaround 我样品采到了，工卫人员要2天以后才知道这个结果要减短这些时间，所以要部署这些快速的当场能够知道的这个机器仪器那么也是通过一个棉签
So that's the little ticket test. Right now, those still require either a nasopharyngeal
反正我也没有去测试过，根本不是很懂，只知道用棉签不知道有很多的很多。但这个按照大陆什么肛门检测，这个实在是闻所未闻。我也希望他们去学一学肛测。
The other one that we've had
我开个玩
in
笑
Canada that we started to receive in November was nucleic acid amplification tests, so RNATs.
那么他也是说到了 11月以后呢，又是什么放大的什么也是核酸检测，他说这些也是比较敏感的也是要用个棉签因为我也跟踪过川普的白宫的新闻简报，就是新冠疫情的。那么他也提到了很多的棉签，美国现在每天要生产多少几百万这个棉签，这个棉签统称棉签 swab 不一定是棉花做的，也就是采样用的这个棉花签一样也就15分钟到20分钟就能够知道结果。那么他也是说这个呢就是用于定点检测，大家就是在这儿大家就可以去。
Quality assurance process to make sure they work.
所以现在就是我不知道，就是中国是在这个新冠检测方面是走在世界前列，还是说和世界脱节？我这个不清楚了。中国发明了这个冷链甩锅甩到冷链、冷包装、汽车配件都是国外的带到中国来的。那么同时呢，又发展了肛门检测为什么我们BC 加拿大都不学呢？是
about where these tests can be used to try and determine where they're best useful.
那么他说现在呢在全省部署了39个试验点，就是刚才他说的几个测试的仪器和方法英文里边那个 pilot 也就是试验。这个我们打火炉就是热水器用煤气热水器或者是煤气的壁炉都有一个 pilot。 这个 pilot 就是加拿大发明的，在英文里边就是表示什么呢？就是这个过渡期试验期，如果在这个期间不好，可以回头走不是真正的。
We've been using it as well.
他还提到了 PCR test， 我不知道这个 PCR 网友大家可以提出来教我们，告诉大家这个 PCR 是不是就是核酸检测还是什么？那么他也是说到，原来也是说到学校的检测呢，原来他说都是用快速的，也就是说什么吐个唾沫或者怎么样因为这个呢他也解释过，快速准确率不高，要求天天检测，也就是说你今天检测的可能阳性的阴性的，明天检测可能是阳性了就所以要这个快速的有一个问题，就精确度的问题和这个稳定度的问题。他说也把学校里边的测试的这个方法也是用到了社区里边去，然后呢几种方法相互补充。
And there's two situations that we use them. One is when for testing of people with symptoms to determine whether they might have COVID.
那么有些呢是有症状的测试的，用快速测试，因为他有症状了因为这样的话很有帮助，因为他已经有症状了，只是怀疑他有没有测试，所以马上就给他快速测试看看。那么有些包括流鼻涕咳嗽马上快速测试马上这个用了很好这个
testing of people in the downtown east side.
那么我们还用于这个东区这个我们的温哥华东区的那些流浪汉社区，给他们他们如果有症状，也是用于这个快速测试的方法给他们检定是阴性还是阳性。
Point of care or rapid tests are in people who do not have symptoms. And it is in that situation that it is more challenging.
那么最讨厌的问题就是很多是没有症状的，这样对于我们公卫系统人员来讲是比较困难挑战的是特别是在长期护理院里边工作的员工他们没有症状，他们每天上班的时候都要
COVID-19
做一个 screening 自我检视一下我有这些现状没有这个现象才能去上班。很多员工都没有，所以他说现在很多都是无症状感染者那么做了几千例呢，现在发觉有2例是这个做出来是所以这个也是告诉我们，如果基数很高的话
of picking up somebody
那
who
么
has an
如果
asymptomatic
挑选出来的
infection
人是阳性的
doesn't
话
have any symptoms goes up,
就算他
and
没
that
有
they're not
症
as
状也
useful
会数字
in
上去
areas where the background levels are low.
那么
So
如
if
果
our
社区
community
里边感染
transmission
数本
rates
身
are
基数
low,
就低
screening with these less
那么你一个一
sensitive
个筛
tests
查的话也
is
不现
not
实，那么
very
如果用这个随机
effective.
抽选
It
票的
doesn't
话呢
help us
那
because
就
the
效率
yield
不
is
高
so
这个有道理
and they have a
如果
very,
整
much
个社
higher
区
false
本来就是这个 阳性
in
率
those
相对
areas where we have an
比较
outbreak
高的
or
那
where
么你就
community
巴拉巴拉随
transmission
机测
rates
试
are
或者快速
higher,
测试
that is
马
when
上
they
就可以
might
挑
have
出
more
来阳性
utility.
阴
And
性
those are the
但是如果
areas
这
that
个
we're
社区
looking
本
at
身
more
这个
closely.
感染率很低
So we really
那么你随
want
机
to
挑
look
选
at
或者是快速测试
accessibility.
它就
It's
不准
helpful
因
in
为你
areas
拿出来
where
都是
the
阴性
gold
都是阴
standard
性的
PCR test
因
is
为
not
都
as
是很多是
accessible.
无症状感染者
Where we need to make a decision right now, so
所以我们现
rapidity,
在他说
where
也是
quicker
做出了一个
results will
决定
change what we're going to do on a
能够
day-to-day
用快速
basis
测
or
试
on a
部署
late
在
now
哪里
basis.
就在部署在哪里一个偏远地区
the
还有是
advantage
对
they
这
have
些
is
有
they're
症状的人
relatively
做
low
测试
cost, the
等
tests
等
themselves, but they do continue to need to be done within a healthcare environment. They are a medical
但是
test,
就算你是
and
这
they
种快
do
速
need
的
to
话
have
还
a
是要
quality
到在
assurance
这个
program,
有
and
医
we
疗
need to
卫生
connect
机
with
构的
public
地
health
方
for
去
every
不是说
positive
自
that
己
needs
测
to
试
be
就测试了
validated,
这个跟
and
美
to
国不
be
一样美国我
assured
记
that
得
we can follow up
家
on
里边都可以
anybody
测试
who
发明出
who
来
tests
的那种
positive.
你可以到沃尔玛去买的
So
药
these
房里
are
边
the
去买的那
situations
这个
that we've
不
been
是
using
比
now.
医生要求还是要到
We
这个
use them where
诊
they fill
所
a gap,
或者实
as
验
I
室
said, and where compliance with public health measures are ensured. They do not take the place of all of the public health measures that we need to have in place. And we still have a lot of questions about places where they are best used. Is it better? A couple of things that we have learned from both the pilots here and across Canada is that acceptability of having a test is goes down over time. It's not comfortable or nice to have a swab, particularly in people who don't have any symptoms, on a periodic basis. And so we know that in the long-term care homes, for
这
example,
个今天伯尼
worker
医生花了
testing
很长时间在给大
could
家
not
解
be more
释
than about
测
twice
试
a week.
策
And
略
is it better to use a
如
point
何
of care test
用
twice
什
a
么方
week
法
or the more accurate
我也
PCR
听
test
了
once a
似
week?
懂
And
非
those
懂
are
因
the
为有一
questions
些
that
是
we're
什么
still
PCR
wrestling
之类
with,
的
both
不
here
是很
in
懂他今天
BC
又刚才
and in
说到了 PCR
provinces across the country.
我要
There's
查一
still
查
a lot that
PCR
we
这
need to
个测
learn,
试到底
but we
中文叫
are
核酸检测还是什
establishing
么？我们
a
现在
rapid
中
point
文
of
里
care
边已
testing
经里边
team
用的
with
最多
our
的核
BC
酸检测。
CDC lab and the
那
ministry
么他也是说到
and
了有些这
partnering
个
with
有
our
些
health
快速
authority,
测试
public
的
health
都是一些点
leads, but also
定
with
点
different
的地
settings
方，
across
不
the
是所有
province to
的
see where
实
we
验
might
室
use
都
these
提供
best.
快速测
And
试。
as we move into this time when we have increased immunization of
那么
people
同
and
时呢，
we're
现在我
moving
们
into
慢慢
our
开始，很多人
post-pandemic
开始
opening
建
up,
立起免疫的
we're
防
looking
线
at
的。
where
那么
we're
我们
going
这
to
测试的策
where
略
there's
又
a
要变
benefit
了。
for different industries to have point of care testing or these rapid tests
那
as
么
part
因为
of
这个
the
快速
opening
测
up
试部
process.
署要到
So these
根
are
据这个
industries where outbreaks
行
are
业
more
来
likely,
了。
like our food processing
比如
industries,
说
like
到
some of
这
the
个食品
agriculture,
加
the
工
large
啊，或
industrial
者
sites.
是
And we
家
are
禽处理厂
partnering
啊
with
等等
industry
去
right
部署
now
到那
to
边
see
去
how
了
those can
啊，
work
或者是
in the
农业，
coming
因为
weeks and months.
工人
Which
要
is all
来
to
了
say, these
国际上的
are
农民要来了
challenging,
那个
we're
他们要
learning
集
as
中
we
在一
go
起
with,
要
with
加拿大的
testing
农业
as
马
we
上要
have
开始了，
with
所以
all
现
the
在随
other
着这个
aspects
大家的
of
疫
this
苗的
pandemic.
快速部署，那么
And
这些快速测试的都要
we now
下
have
放到各个
a
工
written
厂
note
啊
strategy
这些
that will
食品
be
加工厂、
published
家
on
禽
the
加工
BC
厂啊、
CDC
农
website,
场
and
啊
we'll
放
have
到
links
那
to
边
it
去了。
after aligned with our statement later today. So with all that,
所以这总结一
I
下
will summarize by saying,
他说总结一
we
下
are in a new place right
所以
now
我们现在
with
是
the
到了一个新阶
COVID-19,
段。
our COVID-19 pandemic.
那么现在这
We're
个
getting our regular supply of
我们要
vaccines,
提
and
供
more
日
vaccines are
常
on the
的疫
way.
苗，
We
还有
know
更
that
多的疫苗
the
还会
Johnson
来
& Johnson
重
vaccine
新
is
强
in
生
for
疫苗又要
final
来了。
review with Health Canada.
那么
We
现
don't
在
yet
联
know
邦
when it
现
might
在
be
在检
available,
视
but that
强生
will be
疫苗。
another tool, another piece that we can add to
那么
our
这样的话
toolkit.
呢，如 果批准的话，我们
we
有
know
多了一
that
个
we
工
have
具。
increasing protection in our most at-risk people, and that will
所以呢，
increase
这样的话呢，
dramatically
我们
starting
可以
again next
提高
week.
对那些
But
高
we've
风
also
险人
had
群
an
的保
uptick in
护
new cases.
快速的提
And
供给
we've
他保
seen the
护。
rise
那么
of
同时，
some
我
of
们
the
现在
more
看到每天新
transmissible
增的数
variants
字
in
还
our
是略微
communities
上
here,
升。
in
我们都看到
particularly
了这
in
个
the
爆
lower
发
mainland.
这个不是
And we need
变异病毒的
to
传播
follow those and
所以我
monitor
们
them
一定要
carefully.
格外小
We
心，
can't
特别
let
是
these
低入平
successes
原
of these
希
great
望大家
vaccines
能够
that
格
we
外的
have
小心。
now
我们过
be
去成功
diminished
过
by
的
a
地方，我
surge
们
in
还继续
cases that will lead us to a third wave.
我
We know
们要
that
谨
we are
防
taking all
第
of
三
the
波
public
来
health actions of case management, contact tracing,
所以我们还要
isolation,
加强这个
testing,
病例的
making sure
管
that
理
we are
接触
doing
跟
what
踪
we
工
can
作
to
以
contain
及
the
隔离工
transmission
作
that we have
所以
right
我们
now.
一定要做我
And that
们
is going to be incredibly important.
努力的做
And I
我们
know
该
these
做的事情
restrictions
来
and closures in
防
many
止
parts
病
of
毒
our
的传播
society have
这
been
个是很重要的
draining
我们
on all of us.
社区啊
And we all
多
want to
的
get
一
back to
些
our
这
regular
个
activities
禁令
as
还是
soon
要
as we
落实
can.
到位。
We know that the transmissibility of this virus, or at least
他
we've
说
learned that it has a seasonality to it. And here in BC, we're
那
coming
么
up to
他也是
that
说到这
season
个病毒
in
还是跟
April
季节
and
有
in
关
May.
系，大家都可以
I'd
看
like
到了，
to
什么现在
assure
好的季节
everybody
要来了
that
，4月份要来了
routinely,
啊
every day,
那么希望大家每
every
天还要
week,
做
review
这个
the
每天要
the
检视
measures that
自
we
己
are
的措
using
施
to determine
这个
whether
检视
these
一下看看
restrictions
我这个措
are
施对
still
不对
needed, whether there are things that
然
we
后自
can
己
do
决
now
定我哪些能做，哪些
safely
不能
that
做
we，
安
couldn't
全的
even a
去
few
做
weeks ago. And the work we do is ongoing.
我们
We've had
我们
a
现在的
response
工
that
作
is a
也在
whole
不断的进
province
行
response.
那么
And
我们应
everybody
对
has
这
been
个
doing
病
their
毒
part.
的
And
这
it's
个
about using
工
all
作
of
也
our
是大
tools
家每一个
through
人都要
this
参与
next
进
period
来
of time
那么接下
until
来的
we
阶
have
段
more people
我们会有
protected,
更多的
until
疫
we
苗
have
会
a
来
handle
才会
on
受到
the
保护
transmission in our
那么
communities.
这样的话我们
And
的社
it
区
is
的
a
传
whole
播
new
才能够
place that
停
we are
止
moving into very quickly.
所以这
Brighter
样的
days
话
are ahead.
希
So
望
let's continue to stay
希
this
望大
course
家
with
继
our
续
safety
继
measures,
续
staying small,
安全
staying
对去
local,
这
so
个
that we can get
待在
there
本
even
地
faster.
人员少的聚
of course
集
remember to
等等
continue
等等，
to be
请大
kind
家
and to be
始终
calm
记
and
住
to be
be
safe.
kind, be calm, be safe。这个说的真好，邦尼医生说的真好。当然，也有人说我天天看，每次都看邦尼。可能被他
Thank you
洗
very
脑
much,
了
Dr. Henry. I
也
wanted
有
to
可能
start by
那么现在他是卫生厅
expressing
长，
my
也是
condolences
代表
to the
省长
premiers,
和他
those
本
of the
人
government, those of
对
everyone
过
in
去
BC,
24小时死
to
亡
the families and
视力
friends
死
and
亡的
caregivers
家
of the
庭
four
亲
people
人
who
表示
passed
诚挚
away
的哀悼。
in different parts of our province in the
那
last
么
24 hours from
昨天
COVID-19.
死了4例新增4例死亡，总数到了1376例了。那么变异病毒累计到现在是246例，那么其中他说是4例是住院，好像有2例死亡这个是这样。那么现在还在 active 的是10几例，其他都痊愈了。
And are with all of you today.
那么他也是
I wanted to
代表官
note
方说一些什
in
么
our acute
诚
care
挚的哀悼
hospitals,
啊
we。continue to have
那么现在又说到了
the ability
长期
and
护理
capacity
院
and the
以及
beds
急诊性诊疗所的爆发的数量。
absorb all of the demands on our acute care hospital
那么
system.
现在这样看来呢，
There is,
就是我们的医疗资源
our acute
没有
care
被
bed
击
capacity,
垮。目前
the
为止，
occupancy rate is 93.2% of base beds at present, which leaves 642 beds empty and able to take new patients as of today. And if you count the surge beds that we added for the pandemic, that number is 74.4% or 3,053 beds.
那么他也是说到了，就是这个占床率啊，我不也是跟大家做重复了什么空床率是多少，占床率是多少啊？
That's 318 beds available.
因为不是所有的网友从一开始就看我们的转播。昨天一天呢，新增了564例，所以 BC 省现在累计总数到了82473例。那么住院的是248例。其中这个重症监护是63例。
There are currently 8 outbreaks in acute care, 5 of them in Fraser Health, which reflect ongoing COVID-19 transmission in communities.
那么他也是说到了飞沙卫生局下的这个数字，也是体现了在这个地区的这个社区的传播，以及反映了这个卫生局下的医院的医疗占用的情况。同时呢，我们也感谢这些医护工作人员付出的额外的艰辛的努力和工作辛苦。
You'll note from this past week to this week.
我稍微看了看，3月2号还是438，3月4号就564了啊。2月23号是559。
Additional outbreak that was at Glacier View Lodge.
2月16号给大家做简报的时候呢，它是4天452、432、348、308，大家听到了吗？都300多。然后到了2月23号，1周以后就是559了，因为这个是报的是2周之前，也就那时候是超级晚开始了，长周末开始了，农历新年开始了，就是这种情况。
In vaccinating people in
那么也是说到了疫苗给大家施打的疫苗的这些工作人员也是格外的辛苦劳动强度大。
To keep people safe. The effectiveness of that was demonstrated in the data presented by Dr. Henry on Monday and Dr. Ballum on Monday, and is obviously a source of deep relief and indeed joy for people who have families and friends in long-term care, and us who've been working on this issue and are and remain extraordinarily concerned. And that, again, allows us to do something very important, something that we're working to prepare right now, which is to increase the ability and a return to some degree of normalcy. It won't be normal, but some greater degree of normalcy in our long-term care and assisted living homes in the coming weeks. I just wanted to note that next week we'll be providing full lists of immunization sites. You'll note, of course, that since the beginning of the pandemic, given that there have been pop-up clinics at all
下个礼拜呢，他会给大家公布所有的详细的列表，也就是说，大家到哪里去注册，到哪里去打针，打这个疫苗针啊。下个礼拜告诉大家。
And that process will continue in the coming weeks and is continuing now. For example, in this past week,
有一位网友说的是人口灭绝的问题，种族灭绝的问题。也有，我也看到了、听到了这个新冠病毒也是这些优秀的精英人口人士这个阴谋论说精英人士这个全球发动的灭绝人口的一个计划。这个呢，我就听过算过，我不是很相信，我个人不是很相信啊。那么他又说到了择期开刀的恢复情况。
of those patients whose surgery was postponed due to COVID-19, that through our surgical commitment, renewal commitment, we said we would get more patients their surgeries faster, and we're doing just that. The total surgeries completed since the launching of our surgical renewal commitment on May 18th is 70,321 in Fraser Health, 49,103 in Interior Health, 15,032 in Northern Health, 62,992 in Vancouver Coastal Health, 55,034 in Vancouver Island Health, and 10,649 in the Provincial Health Services Authority. For the week of February the 15th to February the 21st, health authorities have verified their data, and the total number of surgeries completed in that week, which remember included a holiday day, was 6,146, which is 256 more surgeries than the same week last year, that during a pandemic, and that is an extraordinary achievement again by our staff, our surgical staff, our healthcare workers, everyone involved. I want to say as of today that 212,105 British Columbians have received their first dose of a COVID-19 vaccine. And with our commitment to get vaccine to 4.3 million British Columbians who want it, 4.93% of us have now had a shot, about 1 in 20. To each of us, the efforts of everyone involved in administering vaccines are a welcome boost, an essential encouragement to our continued use of the skills to stop the spread and our adherence to the guidance and orders that save lives. Our work to stop the spread goes hand in hand with the work of those getting us our shots, giving their efforts the greatest support and the best of chance of success in seeing us achieve the community immunity we need as quickly and as safely as possible. We are counting on each other. As we head into another weekend after tomorrow, let's reinforce this bond. Let's continue to demonstrate the care for each other that has marked our journey so far. Let us stay, all of us, 100% all in our effort to stop the spread. It is as important now as it has ever been during this pandemic. Aujourd'hui, nous annonçons 564 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 82 473 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19, pour un total de 1376 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 248 personnes sont actuellement hospitalisées, dont 64 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You'll be limited to one question and one follow-up only. I would also ask that you please unmute your phones. You're not audible until your name is called. First question today is from Shannon Patterson, CTV.
Oh, hi. Thanks for taking my call, guys. You said that first responders will be offered the AstraZeneca vaccine starting this month. Are you worried some of them that are offered that vaccine will say no and opt to wait until they qualify for the other vaccines under the age criteria? We're seeing a lot of people reject AstraZeneca in Europe because the clinical trials obviously had lower efficacy rates than Pfizer and
那么他也是说到了这个阿斯利康疫苗，很多人可能觉得它不好，不如其他的那他说疫苗和之间呢不能比较这个品牌辉瑞啊、阿斯利康啊、这个莫德纳等等不能是比较。话说回来，我个人如果要我选的话，我选辉瑞。每个人观点不一样。其实阿斯利康对年纪轻的，像我们这种60岁以下的人特别有效，而且它只要打一针，同时呢，它这个储藏要求不高。
There was over 150 different vaccine candidates last summer.
他说，去年新冠疫苗，去年夏天有150个候选，慢慢，你看现在只有几例了，对吧？那么这么多淘汰了，那么现在只有3例在加拿大用3个品牌被批准。
populations. And the one thing about the AstraZeneca trial was
所以他举的这个例子也是说明阿斯利康不会差。我没有说我为什么不选阿斯利康，我个人喜好，因为辉瑞是第一款，所以可能我是先入为主。
Restrictions on use that the recommended restrictions in some countries, including the NACI recommendations here in Canada. I will note that Health Canada has approved it for use in all adults based on real-world experience as well as the clinical trials. But the clinical trials data was limited in older people, and NACI recognized that. They said, we know it works really well in this younger adult age group, so focus on that. What we have been learning, and I mentioned that in my opening diatribe today, but we're learning as we go with this. It's rapid response research. It means that we take不断的得到新的知识，关于疫苗包括研究那么英国是打了大量的这个疫苗。The AstraZeneca vaccine works in older people from the UK within the next few weeks. Because they have been using both vaccines, Pfizer and AstraZeneca, in all age groups, but starting with older people in the UK interchangeably. And we are seeing good response from both vaccines
所以我们这个全球来看包括英国、印度生产的阿斯利康都是在全球得到了很好的效果。所以我们会也期望有更多的当然他说我们也期望更多的消息信息特别是阿斯利康对老年人有效的数据能够得到，期望得到这些。所以他说在英国这些品牌的疫苗混起来打的这个上次说过了因为是同样的技术 mRNA 技术，所以呢你第一针打的是阿斯利康，第二针可以打辉瑞等等。
But if we look at the data and the different arms of the trial, they did a single dose arm. And the prevention, the effectiveness, the efficacy, so that's in the trials we call it efficacy, in real life we call it effectiveness.
那么它也是它这个efficacy 帮 effectiveness 还是不一样，我要做一些功课啊，有效率，这个都是有效率，中文翻译都是有效率，英文里边有点不一样啊，那个。12个礼拜以后，还是有87%身体里边的抗体有效率。所以他说这个还有很高的，第一针打完了之后都是很高的这个抗体水平。所以世界卫生组织设计了底线啊，这个所有的疫苗都有效，都安全啊。所以，如果你接受我们给你什么疫苗，你就接受什么疫苗，这个是我的建议。都是3个礼拜以后开始，身体里边的抗体都是高水平的发挥出来了。他说强生疫苗马上要批准，因为加拿大现在在检视。这些所以有点不一样，但是他们都是新的，他们有些是相似的，所以我们也会提供给一些这个优先次序，谁先打谁打哪些包括那些基础工作的人，哪些是基础工作的人，哪些行业的人先打阿斯利康都是集中给这些打，因为他说主要呢这个便于储存不像这个辉瑞那么脆弱。所以特别适合到这个工作场所的地方去打，特别是食物加工厂啊、家禽加工厂等等。
At one facility, families say there appeared to be a blanket policy of denying the designation to everyone.
那么这个提到的是养老院的探访的规矩。那么有些人可能也是。
Does it concern you that some families were treated unfairly?
他说你们现在指定探访，也就25%的老年人受惠于这个政策。他说我们制定的政策呢，都是跟相关的行业的顾问提供的意见跟他们交流做出的决定。
That is outlined in those guidelines of where to go if you feel you've been inappropriately denied that essential visitor status. So that is important for people to know. It's on the website. It's linked to it on my website, the PHO website with the order.
所以他也是说到了，请大家呢做一些这个网络上的调查学习研究一下。
His office has a role to play as well, as does my office. But your first step is to go directly to the administrator of the facility that you're working in, and there is a time-sensitive process that they must follow.
所以你要申请作为老年人的基础探访人员，你们还是要花点时间去研究一下，然后呢花点时间，因为这个决定，他们要做这个决定批准你，是说成不成为基础基本的探访者，也是要点时间的他本人和医生本人又不能做具体的决定。那么我也是希望每一个申请的人都能够批准，这个是他的愿望。
Dr. Henry, can you give us some details on what clusters will be targeted with AstraZeneca? Are we talking regional or types of clusters, and how many AstraZeneca vaccines are we expecting to receive with this expiration date of the end of March, beginning of April?
他说3月底4月初，你看看哪些人可以接受阿斯利康的疫苗？他说我不知道就像我们回到12月份的时候，我们根本不知道疫苗会到什么程度，所以我们现在也不知道下一步这个疫苗会有多少的哪些部分的人打这个阿斯利康的疫苗，哪些人是打这个第二针，我们现在还不知道。那么我们会知道到货的具体数字。我们可以从数据分析来看。
rolling average of cases, the outbreaks, the clusters we're seeing in communities are in the lower mainland particularly, and that's where some of the more recalcitrant outbreaks have been. Some of them are in food processing, some agricultural working. We're also looking at some ongoing outbreaks in the north. So my public health team and the BC Immunization Committee are looking at where we can best stop these outbreaks that are ongoing in people who don't necessarily have the ability to effectively use personal protective equipment and barriers in their workplace. And food processing is the highest risk of those industries, and we've had ongoing outbreaks that affect large numbers of workers, and not only workers but the community. So people who are getting sick in a food processing plant in the Fraser Valley, many of them are lower paid workers who live in communal large settings, either communal settings or in multi-generational households, and this spillover into our communities that then is into other areas through transmission to family members. So those are the types of outbreaks that we can make a big difference on right away with the added vaccine that we hope to get in next week. But the prioritization of that is with my public health leadership team right now.
做出具体分析，才来把这个疫苗去跟制定政策去给他们施打。
Rates of burnout from paramedics that are incredibly high. We've heard from one that said that 10 to 30 ambulances are down on a given night because of that burnout. What are you doing to address those concerns, and what do you say to British Columbians who may be underserved by paramedics because of the burnout that's happening from workers?
Can I say a word first, just to put a shout out to my colleagues who work in the BC Emergency Medical Services and our ambulance paramedics everywhere in this province, the community paramedicine program. It has been an incredibly challenging time for paramedics and for all first responders, but with both of the public health emergencies that we're dealing with, and I know it takes a toll on us physically, but also mentally and emotionally as well.
救护车以及救命车、救火车等等这些工作人员，他们都是叫急救人员first responder。那么他因为这个记者问的就是你怎么定义他们，给他们做这个疫苗。是的。
In this time, we have two public health emergencies, as you know. On the ground,
他说我们现在 BC 省现在有2个紧急状态。
ambulance paramedics, the impact of the
这个我不是很清楚，2个紧急状态，我只知道新冠疫情紧急状态、卫生紧急状态，还有一个什么不知道。因为这个所谓紧急状态呢，他们就各个部门他应对是跟在这个状态下有具体的措施程序，主要是程序。西方国家主要是讲的是程序，也就是说我在什么环境下、什么制定什么样的程序，按照什么流程走。
Significant ambulance paramedics positions in the last 2 years across the province of British Columbia, including very significant additions in rural and remote areas during this pandemic to address the challenges of COVID-19 and the need often to get people to regional hospital centers more quickly. The significant number in the intervention of ambulance paramedics, for example, in communities such as Fort St. James, in the Cariboo and other regions, has been a sign of this, and we're obviously very concerned about that work, and we're working very actively with the Ambulance Paramedics Union, QP Local 873, the Ambulance Paramedics of BC, to ensure that we're addressing quality of life issues amongst ambulance paramedics. I believe I'll be meeting in the very near future with the President of the Union to discuss those ongoing issues. I think I would say that together with our ambulance paramedics, we were able to together negotiate a collective agreement, freely bargain at the bargaining table, which was an enormous achievement. And we've significantly increased the number of both ambulances, access to air ambulance, and the number of ambulance paramedics in BC, and expand the community paramedicine program. All those things are things we've been able to do. But the daily reality of life that you talked about in your question is real, and one that we're working with our ambulance paramedics to address, to assist, and to provide the kind of support necessary.
所以他也是说到了这个行业啊，这个记者问的主要是救护车行业里边的工作人员。他们的报酬啊等等啊，这些因为他们工作压力大，强度高。
So the one local sick temple actually raised a concern on behalf of the community regarding the limit and how it's affecting the mental health of those who are
谢谢
unable to
Lisa，
keep the passing
谢
of the
谢
loved
谢谢，
ones due
我
to
因为没
COVID
有时间，
restrictions.
因为
They
在
can't
做直
visit to
播，
the
所以
hospital. They
PCR
can't
我
even
下
attend
下
full
了
family as
我
a
这个
funeral.
这次
Even
直播完
not
了，我去
able to
查
attend
一
as
下
a family
PCR，
the
我
last
谢谢你
prayers
的
of the
帮
loved
助。
ones, which is very important for the Sikh culture. And they are
您可以
asking for
写
the
在留言栏里边，
increase
我
the
可以
number of
读
people
一
to
下啊，这
attend
个
these
PCR 是不是
funerals,
我们大陆
especially
说的
the
核酸
temple
检测？
prayers, because the temple has a huge space. They
啊，
can
这个印
maintain
度
the
口音的
protocols
记
as
者
well.
主要是说的是葬礼
No,
和这
and
个宗教仪
I
式
hear that,
啊，那
and
么是不是他说
I
还是
do
要
feel that
用现
deeply
在
for
这个
many families
禁令，
around
还是
the
维持
province.
这个禁
It
令？
is the most challenging time, and
那么
funerals
他也是
are
说，这个殡葬
those
行业
times
这个
of,
一年来都是很困难
both
啊
grief。and
他这个困难
celebration
不
of
是指
lives
这个
that
行业困难，是指
is
大
very
家只要有这个
challenging
经
for
历的
us
话
to
啊，
to
都
keep
要经历
small
过
and
这个
to
人死亡的话，就
postpone.
比较困
And
难。
I
有
know
些
for
人
many
想送亲
different
友，有些人
faith
想送这个
communities,
亲
there are
戚都不能
different
做
important
啊，因为
rituals that are
有限
around
制令。
death that need to be done. But I also know
那么这个
that
刚才
there
那
are
个印
ways
度
that we
的
can
口音的
support
女记者
people
就是问
to
的这个
do
问
it
题
safely
啊，
through
没
this
办法
most
的。他说我们
extraordinary
还
of
是要
times,
相
the
互支
global
持。现在这么
pandemic that we are all
全球
in,
流行
and
病
we
这
have
么
seen
困难的时
heroic
候啊，
examples
我
of
们还
that
是需要
from
相互支
different
持、
faith
相互理
communities
解。
across this province, whether it's Sikh or Hindu or Muslim or
他也是说到了这个穆斯林啊、锡克啊、印度啊这些教啊，你们的包括天主教啊，包括这些还有这个原住民啊等等啊，我们只能是用一种办法想出来办法目的是主要是为大家安全啊，希望大家再耐心一下，再等等啊。我们也是知道每一个人失去生命都是很重要的一个仪式形式啊，这个仪式形式也是很重要的。所以这个也是卫生厅长他说我的很多朋友也是在这个南亚他也是说到了南亚社区，其实也就是印度啊、巴基斯坦啊，包括穆斯林啊等等。他说有一个我很要好的一个朋友2个礼拜前。他的父亲去世了，他也只能召集了9个人做了一个简短的纪念仪式这个是只能是按照规范来。所以他说这个也是做出的相应的牺牲。
who have passed away related to an infection of COVID-19, but everyone who's lost loved ones who hasn't been able to fully grieve or fully recognize that loss. And so that's something that all of us are going to have to think about doing at some point in the future when restrictions are reduced, find ways to come together to recognize, to celebrate the lives of the people that we've loved who have passed away. So we appreciate that.
所以他也感谢大家的理解自己亲爱的人都过世了，也不没办法。这个
overwhelming majority of those cases at this time, it was different in January, but at this time are in Metro Vancouver. Significant numbers of cases.
他说又和1月份比起来，现在这个特别是温哥华地区现在这个数字还是这么高所以希望大家还是严格按照我们的行为规范指引去做这个是很重要的希望大家这个很重要，不要再聚集，不要特别是这个葬礼婚礼这个是不严格禁止的
people often write me about the movie industry or about cinema, being able to go to a movie. And, of course, many events that bring people together in our own homes. But we have to stick together to stop the spread right now.
我们大家要相互支持他相互提醒不要再这么做这个坚持下去
all of us, every single one of us have felt personally in the last year because I doubt there's a person in BC who hasn't lost someone
所以这个用成语来说就是语重心长了，只能是口口婆心你真的要做也没办法 在加拿大呢，主要还是靠自觉自律执法的成本没有中国那么高，因为政府小，执法人员少，只要还是靠你自觉了。所以导致了现在还是每天新增500-600、400-500这个新增这个数字居高不下，这个没办法不可能做到前后2把锁。
As we start to vaccinate people, 5%. At this time,
那么我们现在呢，全省是5%的人已经打了疫苗，所以这个每天都在进步，点点滴滴的进步都是拯救生命的。他说。
Prabjot, do you have a follow-up?
Yes, please. The latest poll suggests 60% Canadians suffering the mental health issue due to COVID, or some experts suggest we might see the mental health tsunami after this pandemic. So is there any take on that?
加拿大人60%的加拿大人都有这个心理健康问题。
And we know from literature on other crises that a lot of it depends on the support that we get as a community. Resilience is really a community effect, more so even than an individual effect. Our ability to have our individual resilience is also dependent on our community. So that is a really important thing to remember that we know from previous crises. We also know that there is a sense of anxiety that comes with the uncertainty that we're living through, and that all of us are feeling it to some degree or the other. Some people are float above it, if you will, but many of us are feeling it intensely, and I'm particularly concerned about young people. And people in their teenage and early 20s because they had the least ability to affect things in their lives and been the most changed, and they feed or they have the anxieties that all of us as adults are feeling and projecting into the world as well. So, we need to pay attention to young people, we need to support them, we need to look to providing additional support for the future for young people. Because if you're one of the young people in my life who graduated from high school last year and didn't have a celebration, who had very limited job prospects because of what we were going through. University is a remote thing that you don't even get to connect in a period of time where social connection is so much a necessity in one's life. It's how you find your way in the world. So this is something that, as you can tell, I'm quite passionate about. We need to support mental health for all of us right now, but we need to look to the future for how do we build those things in place that allow particularly our young people to recover from this most traumatic year in that way. And we have been doing quite a lot of work on the societal impacts of this pandemic and the societal consequences, not just of the virus, but of the measures we've put in place to deal with the virus. And we've been monitoring mental health issues as well. So we know that early on there was a lot of concern about mental health. We've had increased people phoning helplines, especially young people. We know that there's increased interpartner violence and violence against women that have been triggered through this process as well. But we also know that there are things that we can do that help diminish that, and that most people will recover in time if we have the right things in place. So this mental anxiety, depression, concern that we're going through now, we can recover from that, and most people will if we're able to continue our sense of community and find those right supports for people. So yes, I'm very concerned, and we are looking at the impacts and what are the specific measures that we need to have to support every one of us in the next month to a year, because it's going to be a long time for this to play out as well.
Next question is from Marcella Bernardo, News 1130.
专业术语，那不是核酸是吧？不是核酸吗？
Thank you again for taking my question today. First up, I know you touched on this a bit about the approval of vaccines.
他说，我刚才听的这个 Bonnie Henry 是说到了 PCR， 这目前是最高的准确率。那么他这个记者又问到的是阿斯利康疫苗的问题。
In their 20s that are struggling right now. Do you think that we will be able to move the timeline up sooner so that we'll see a lot of younger people being able to get at least their first dose over the summer?
那么他也是说到，因为现在阿斯利康疫苗已经出来了，而且是对年纪轻的人还效果更好。那么是不是他说能不能先让年纪轻的人先打？这个记者提的好问题，因为年纪轻的人这个心理健康的问题太重要了。他说能不能先让他们先打一点？那么他说下星期一我们就会知道阿斯利康会来多少。那么但是我们的这个疫苗政策还是按照年龄段来，这个是我们的基本政策。那么如果有额外的这些多出来的疫苗的话，我们会给那些那些特殊需要的人。
people who are more likely to be transmitting. So in terms of being able to reduce the effects of the virus and transmission in the community, targeting as much as we can to essential workers and to frontline first responders. That's going to help us reduce transmission in the community. So it does that dual effect. And our goal absolutely is to make sure that we.
所以刚才又提到了这个问题，就是我这个计划，比如说3月份是按照这个计划是40万人，结果呢，各种各样原因，比如说疫苗这个供应量增大了，到货更多，那么他又说提到了这个更多的多出来的呢，就会给哪些人先打这个问题。
first contact with the enemy, but we are going to do our best, and we are going to make sure that young people have that experience. And I think by the summer we're going to be able to be doing a lot more of those connections that we need. That's going to help us get through the trauma that we've all experienced together.
Follow up, Marcella?
I do, and I don't mean to be a Debbie Downer after what you just said, but with at least 16 schools in Fraser Health now recording at least one variant case,
他说，树里的一个菲沙卫生学校有一个新的记录，有一个至少一个学校里边有一个变异体发生变异病毒发生你们有没有快速的禁疫机制？那么你知道现在有16个学校有这个变异病毒了因为这个变异病毒传播非常快速。他说我们这个应对社区传播的也有一套应对机制。那么特别是学校的环境里边
And yes, it does mean that we are doing extra testing, particularly around the variants, because we are concerned about that increased transmissibility that we've seen elsewhere. I say that because I believe there's about 23 exposures in 23 schools that we've seen so far, and we have not had a lot of transmission. There's been 1 or 2 cases at most. I believe last I checked it was
这个一例两例我在直播之前就说了，一例两例都叫 exposure.
So that, despite doing a ton of testing to be sure, so that's the good news. We're not seeing widely taking off transmission from these variant cases, but it is tons of 也就是很多测试。现在还他说好消息，做了这么多测试，还就是这些数字阳性率这个意思就是好消息。所以在学校里边的爆发没有发生。 Community, both the educators and students.
所以对教职员工以及对孩子们来讲
I will say as well that we know the rates are higher in some communities than others.
但是我要说的是，有些社区的这个传播率是比其他地方高。特别是树里的这个卫生局下的树里地区我相信树里地区主要是印度人传播的 牛顿地区比较多
We have
学
time
校
for one more
啊
question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Tanya Fletcher, CBC.
Dr. Henry, just jumping off of Marcella's last question there, asking for a colleague if you could any detail more precisely about the variants of concern in schools. You mentioned there are 23 confirmed cases recorded at BC schools. I believe that's what you just said. Can you confirm that between 5 and 8% of the COVID cases in BC schools are now variants of concern?
No, it would not be that high.
他说没有那么高，5%到8%。
That's
没有那么高，他说啊。
Anyway, I'm sorry, I have to get back to you on that.
那个比例啊，因为记者说的5%到8%。
We're seeing is hovering around 1%.
他说这个变异病毒整个是在1%左右。
I know there was 23 schools that had
有23个学校有爆发。过去几个礼拜自从测试推广以后对这个变异体。
There's not been very much transmission.
但是没有看到很多的传播。
Follow-up, Tanya?
就像我刚才说的，没有看到很多的传播。
Please, thank you. Hoping you can outline as clearly as possible the plan to resume visits to long-term care homes. Now, you mentioned, I think Minister Dix mentioned.
那么他也是说到了，请你能够提供恢复这个探访长期护理院的具体的时间表因为现在有很多老人开始要打第二针了你们以后现在要开始说的这个又延长了这个第二针的打，但是呢，疫苗现在又开始增加。现在因为你们一针和第二针都是要4个月间隔。
No, I can't give you all of the details because we're still working on them. But you know what we want, what we are learning, and this is the thing. As I mentioned, we know more this week than we did last week. We made the decisions we made because we have now seen, particularly in long-term care, that if you immunize everybody with one dose, you get to that level of protection that we thought we had to wait till a week after 2 doses to get. So what that means is you don't need that second dose before we can increase interactions in long-term care homes. That the residents themselves are protected enough from that single dose that we know we can use the second dose to protect others in the community now and provide a second dose when we have a better understanding of what the best interval is. So the protection level that we're seeing after the first dose in long-term care means across the board we can now step up that time to when we can have increased visits,
所以这样的话呢，我们就可以增加
他们探访的次数，
然后呢，可以更多的人和人之间的交流和接触。但是我们还必须要小心。那么，因为病毒还是在社区里边传播，特别是在这个长期护理院里边还有风险。所以我们还是要提供给他们这个个人防护服。我们不希望再把新的病毒或者什么样子
to be immunized and then be exposed, and visitors themselves can be exposed. So it won't be back yet to what we used to have prior to the pandemic, where people could come and go freely, but it will be much more than what we had over the last few months. And there's more freedom for those who are protected themselves, so the residents, to be able to safely go out to medical appointments, to safely go have a visit with their families and come back and know that they're not going to be at risk for their whole community and care.
风险会更低。那么现在卫生厅长用法语，那么不是所有的那么这样我再说一遍数字。在过去24小时里边新增了564例，那总数 BC 省到目前为止是82473例，其中飞沙卫生局是279例，延安卫生局新增了168例，岛上卫生局新增了35例，内陆卫生局新增了36例，北方卫生局新增了46例。目前为止全省 active 的就是记录在案的活跃的案子还有4743例。 我记得他说的8000多个呢，还是在监视下，公卫系统监视下隔离。那么住院的是248例，其中63例是在重症监护。很遗憾，过去1天里边新增4例死亡，跟新冠相关的死亡案例是4例。到目前为止，从1月底到现在，那个变异体，英国变异体和那个南非变异体的一共阳性案例是246例，那其中呢有16例是在 active， 其他的都痊愈了。当然，Bonnie Henry 也提到了，有8个住过院，其中2例现在还在住院。还有2例已经死亡，这个就是246个变异体的这个情况。那么到目前为止呢，全省已经有298051个人接受了疫苗施打，其中86746个人是接受了第2针的疫苗。这个就是今天BC 新冠疫情的最新新闻简报的基本的数字，及的基本的内容。那么各位网友，感谢大家的收看，祝大家有一个愉快的周末，也愿上帝祝福每一位人。我们下周一再会。